Welcome to this national training program, master's training program on STG on musculoskeletal disorders. So I hope you have arrived yesterday, in the early morning today, from a very long distance from Kerala and Tamil Nadu and Puducherry. From I think no other state is represented here actually. Puducherry, Kerala and Tamil Nadu only. Okay. So I thought that even in some part of Karnataka there are some Siddha dispensaries are there, and even Andhra also it was there. So somehow they could not make it actually, no problem. So once again welcome to this training session. So you may be wondering why this kind of national level training program for particularly for the disease conditions in the musculoskeletal disorders we are conducting actually. You may be knowing, are you aware about the National Ayush Mission guidelines and other things? How many of them are involved in its implementation? Okay, one. Any other persons are involved in the implementation of the National Ayush Mission? Because all are the part of that actually. Okay, so under the National Ayush Mission there is a component of under the public health program there is a component which is called as musculoskeletal disorders, the management interventions of the public health program. So there also we are actually assisted, the Ministry of Ayush assisted the states and UTs including the Tamil Nadu, Kerala and Puducherry. We have assisted the state governments for implementing this component. So after my session, there would be one session on the modalities of implementation of that component in the field, and what are the guidelines available, how to monitor it and how to report it actually, and what are the essential guidelines regarding that. That will be separately, it will be dealt. So in addition to that, and even in that context also, Ministry of Ayush, you may be knowing that we have created an Ayush vertical in the Directorate General of Health Services of the Ministry of Health and Family Welfare in April 2022. So the purpose of that Ayush vertical is basically to have a convergence or integration into the mainstream healthcare wherever possible. So with that objective, we have created that Ayush vertical in the Ministry of Health and Family Welfare, that is under the Directorate General of Health Services. So after establishing that Ayush vertical in the DGHS, we have undertaken many convergence activities. One of the important activity what we thought that it should be undertaken is the preparation of the standard treatment guidelines actually. And most of you are aware that National Institute of Siddha already made standard treatment guidelines for certain disease conditions earlierly, and that is what, is it correct? Okay, so it was available in the public domain. Have you gone through that guidelines at any time? Okay, so now again taking it up of preparing the another set of standard treatment guidelines, the purpose was like that there is a need to have a dialogue between the modern medicine and traditional medical systems in the country, and the call for integrated healthcare is coming fastly in our country also. So how to approach this subject? Integration will not come within 1 day or 2 days. There is a need for sustained efforts between the communication between different medical systems. Until and unless that is achieved, you cannot expect any kind of what you call integration in the field. So based on that, when we came into the Directorate General of Health Services, the first task DGHS asked us to perform is the preparation of the standard treatment guidelines in a convergent manner actually. So accordingly, we have initially made a lot of efforts to how to go for that actually. So first of all, we have to define what is the STG, standard treatment guidelines, whether any specific objectives are there by preparing the standard treatment guidelines. If you go through this whatever the available literature on STGs, you can see that It is a systematically developed protocols that outline the appropriate steps to diagnose, manage and treat. So not only diagnose, manage and treat, even the prevention, promotion and mitigation, because these and rehabilitation. These four items are the strength of the traditional medical system, including Siddha, Ayurveda, Unani and even homeopathy. So that aspect is generally uncovered in most of the conventional medical systems when they prepare the STGs actually, and the focus is only the curative aspect actually. So what we thought that there is a need of preventive management. That is why in the existing STGs given to you, there is a separate section for the preventive management. There is a separate section for the dietary interventions, which is supposed to be carried out by in different conditions of the musculoskeletal disorders. There is a separate section for the incorporation of the yoga interventions and physiotherapies, which aid in rehabilitative care in such chronic disease conditions. So that is why the existing STGs that we have made comprehensively by utilizing all these principles of prevention, promotion, mitigation, then diagnosing, management and even the rehabilitation. So that all strengths have been incorporated and delineated in a systematic manner. That is one thing. Second one, why it is important in healthcare, whether because all of you have undergone the 5.5 years of graduation studies and many of you are already postgraduates. So naturally you think that whether any separate STGs are already required other than your classical Siddha text and whatever the teaching and clinical guidance given by your education institutions. So it is required in terms of, because whatever the documentation given in the classical textbooks may be very wide, broad, and it is actually may not be described in the context of the public health setting. So we would like to make this guidelines in the context of public health facilities as available in our country. For example, if you say in the Tamil Nadu state actually, the lowest level of Ayush, there may be some dispensaries are there, and now it is being converted into the health and wellness center, the modern nomenclature, again the Ayushman Arogya Mandir Ayush, that is being converted into that. Above that level, there may be some co-located facilities in the community health centers and district hospitals. Standalone Siddha hospitals are there, and even teaching hospitals. So there is a clear set of hierarchy, even though it is very not clearly defined in terms of population coverage, even though it is not defined in terms of what you call resources available. At present, such set of institutions are available, whether it is in the state of Tamil Nadu, Kerala or even Puducherry, it is available. But somehow we have not mapped these facilities systematically and made it into a what you call the enabling guidelines which is required for the physicians and other medical staff to practice in an effective manner all these functions actually. That is why incidentally I will also tell you that the Ministry of Ayush last year has already drafted the Indian public health standards for Ayush facilities. Are you aware about that? Okay, some of you are aware actually that the ministry has actually set up a national level committee to draft this Indian public health standards for the Ayush healthcare facilities, including Siddha system of medicine also. It is a part of that actually. See, in which we asked the states to map their facilities on the basis of population. That is the first what we have asked the state. So state responded. Accordingly, we understood that there are little bit gaps in different areas actually. There are certain areas where it is not, the population is not covered by our healthcare facilities, even though the modern healthcare facilities and conventional medicines are available actually. To that extent actually, many of the area actually, suppose Siddha or Ayurveda systems are not covered appropriately. Accordingly, we asked that you identify and we postulated that for minimum 5,000 population, one health and wellness center is required actually. This is the same analogy that they used for the conventional medicine actually. So for 5,000 population, there is a health and wellness center is required. Similarly, even for the hospital setup also, for 50,000 population, at least one Ayush Siddha hospital it is required actually. So for the teaching hospital, like that, a very tier of healthcare facility, we have made certain assumptions based on the mapping provided by the state governments, and accordingly we have tried to define what are the infrastructure required in these hospitals and dispensaries, what are the manpower, essential manpower required in these Siddha dispensaries and hospitals, even the essential medicine. And earlierly the Ministry of Ayush, you may be knowing that, published the essential drug list, and I hope most of you may be following that essential drug list to some extent, because obviously you are purchasing the medicine from the either through the TAMCOL or IMCOPS for the Siddha system of medicines actually. So thereafter, when we crafted the IPHS guidelines, we have also included the minimum essential medicines for the Ayush Health and Wellness Center, minimum essential medicines number of required for the 10 to 30 bedded integrated Ayush hospital, and minimum essential number of medicines required by 50 and above hospitals, like that. So that a gradation has been already been formulated in the existing Indian public health standards. You can refer to that also. Then after that, we insisted that there is a certain step of standard treatment guidelines should be adopted while making any kind of interventions in these public health facilities. So currently, when we go through these standard treatment guidelines, only in some systems of medicines it is available. Even though it is available, it is not complete actually. So there is a need to make systematic way standard treatment guidelines made available for the practitioners and other medical staff in the public health facilities. Later we can also extend these STGs to throughout the country, even for the private practitioners also. At the first instant, we would like to implement in the public health facilities. So there system wise specific STGs wherein certain additional inputs we are actually provided in these STGs. That additional inputs, what are they, that I will explain. So here the consistency and standardization, that is very important. Then patient safety, ultimately this STG will provide a what you call, generally we think that suppose we are not using the STG, then what is the impact on the patient actually. As far as patient is concerned, undesirable or unwarranted medications can be avoided. That is one thing, first and foremost one thing. Second one, the period up to which a prescription is valid or prescription is useful, that also can be clearly mentioned in the through that kind of understanding will be there for the physician to be followed. For example, many of the medications generally what in Ayurveda what we call as Rasayana, or even in the Siddha system also, that is how up to what time period it can be used. There is a, for every medication there is a time period until up to which it is actually is therapeutically effective, therapeutically very compliant to the patient. After that its usage may be harmful. We are not knowing, and there are certain medications where the metallic preparations which is also used in the Siddha system of medicines, which may be required to be frequently taken, the liver function test and other things, even though we presuppose us that these medications are not harmful, adverse deleterious effects are not there due to its processing and other things. Simultaneously we take that stand also, but there is a need to have that kind of what I say periodical the testing of the liver enzymes and other things to rule out the any toxicity or any safety issues actually. So based on that, the standard treatment guidelines should also specifically ask the up to the period in which these medications are warranted. Then resource optimization, that is what I told, that for different tiers of healthcare facilities, different what you call medication. In health and wellness center you cannot expect the entire medicines of the Siddha system may be made available. The government resources also have certain limitations in terms of, because it has to be spread evenly throughout the state, throughout the country. So for that purpose actually we have to understand, for managing for example, lumbar spondylosis, managing this condition actually only this much of medicines are at a primary level it is required. Further, if there is a resistance, further there is a chronicity, further there is a exacerbation of the condition, then it should be ideally referred to the higher centers actually. Higher centers, or even in that case if it is very miserably manageable, then definitely it has to be referred to the modern system of medicines as per its their capacity to deal with the case actually. So, based on that, the resource optimization is also one of the important aspect, evidence based practices. Ultimately, STGs are evolved based on certain documentation. ऐसा नहीं है आपका जो classicals में जो बताया है पूरा, that means whatever it is described in the classical textbooks of Siddha or Ayurveda is simply it has been reproduced. It is not like that. Whatever practiced in the national level institutes or research councils, whatever documented, whatever they published in the public domain and the research peer reviewed research journals, that alone is taken into consideration while preparing these STGs even in the Siddha system of medicine. That is what I think. Then it can lead to the better patient outcomes. Ultimately, these kind of following these STGs vigorously in the field at a very level will definitely enhance the patient outcomes. So, the objective of this training program is basically to familiarize all you as master trainers to its structure and components, how to impart the training in the field level, because you are supposed to undertake this training program further in your states actually, in the Tamil Nadu, Kerala and Puducherry actually you are supposed to undertake this training further to the field level officers, medical officers. And it will teach how to apply the STGs in clinical practice effectively. So, by orientation we mean that because all you are actually learned in terms of your clinical practice and your education. So, the hands-on training may not be at this time is feasible at this time, but if you desire so actually later period actually in your educational teaching hospital etc., some kind of hands-on training can also be taken care actually, but at this time it is intended only a primary orientation on these disease conditions and effective management through adopting the STGs. Then develop skills for managing patients using STGs and encourage adherence to the guidelines in Ayush, because ultimately we intend that every patient is actually having a unique ID, preferably the ABHA ID and other things are coming in the conventional medicines, and we would like to implement throughout the country ABHA ID, so that the patient records, whatever the documentation you are doing are really based on certain basic principles underlined in the STGs. Its role is also enormous in various other sectors. For example, insurance sector. You may be knowing that earlierly also many of the insurance providers have generally taken care the Ayush treatment for the insurance reimbursement purpose actually. But now in the April 2024 the guidelines provided that for all the traditional medicinal sector there is a need to strengthen the insurance coverage. That is what the guidelines given by the insurance agencies actually. So, the guidelines given to the insurance agencies. So, there very clearly mentioned that they will adopt, the assessors will adopt the insurance claims based on standard treatment guidelines. So, there also we require the standard treatment guidelines, and ministry is in the particularly the Ayush vertical has actually coordinated that specific activity of preparation of the standard treatment guidelines in a very comprehensive manner for the purpose of insurance providers also. That is also separately taken up actually. Then integrated healthcare. Some of you may be knowing that we have proposed an Ayush integrated department in all the aims which is coming in the country actually. So, there even for the Siddha system of medicine, sometimes one or two aims. There will be a Siddha teaching integrated department will be there. According to that, the academic departments, professor, associate professor and assistant professor post will be created, and that teaching departments will do the functions of the teaching, research and clinical services actually, and in an integrated manner. So when we speak about the integrated manner, definitely there is a need of certain guidelines to initiate with. So who will provide that guidelines actually? So that guidelines will be initially emanate from whatever standard treatment guideline that we have prepared. Then it will reduce the health cost. Already we mentioned by limiting the resources, actually by limiting the unwarranted use of the medications and optimal use of the medicines and other services in the facility, you can limit the reduce the health cost. Timely referral, this is very important. Many of time there is a argument that many of the traditional medical system unnecessarily take the patients for a longer duration of the time without knowing its implication, and they take the case, and later when the cases worsens, at that time they refer. So this should not be happened actually. We should know our limitations very specifically, where we can clearly intervene, because our strength is enormous. There is no doubt on that actually. But enormous in the sense we have to understand at which stage of the disease we can effectively manage the case actually. That identification of the stage of the different clinical conditions, that is very important for an effective management of any cases actually. So appropriate referral guidelines, which is also be included in this standard treatment guidelines. Then it also limit the side effects, and digital health and technology, we intend to have developed a reporting system for reporting back to this the usage of the STGs in the field by the physicians through appropriate either through the mobile app or the web enabled system. We will use it, so that ultimately this will be captured in the larger HMIS. So you may be knowing that I don't know whether in Tamil Nadu whether a separate HMIS has created for the Siddha system. National Institute, I know that is that AHMIS is there, but whether it is adopted in the routine public health facilities, that I know, but other facilities it is not there. So that is why we are now intending to already we have discussed with the Ministry of Health and Family Welfare HMIS division to have an HMIS for the our traditional systems like Ayurveda, Siddha, Unani and homeopathy, and which we will also explore how to take which are the data elements which we can take from the AHMIS also, because AHMIS is oriented towards some kind of research proposition actually. When we come to the field level organizations, it should be as simple as possible, so that the reporting will be easy by the physicians which are actually available there actually. So based on that, we are actually working with this Ministry of Health and Family Welfare HMIS division, and accordingly shortly you can expect these HMIS. So one of the important component to support that HMIS will be these kind of STGs. So there also your active interventions are required. So this is the infrastructure what we speak actually, where these STGs will be applicable, where these STGs will be implemented. These are the number of institutions which is actually under the states and UTs. It is not the exclusive data for the Siddha, it is an exclusive it is inclusive data for all medical systems, which is traditional medical systems in the country. 3,844 Ayush hospitals. Similarly, the 36,848 dispensaries, and Ayushman Arogya Mandir, as you told, the health and wellness center, 12,500. Out of that, around 1,200 already made into functional status. Then, in addition to that, the public health facilities like PHCs, community health centers, and district hospitals, where the Ayush units are co-located, 13,222. So these are the gamut of healthcare facilities available under the states and UTs. In addition to that, the central government also have their own healthcare institutions, which either in the CGHS, Central Government Health Scheme, even the ESI, they have their own Ayush units are there. In the Ministry of Coal, it is there, Ministry of Railways. So various other central government organizations, Ministry of Defense, they have Ayush units are there. So various other central government organizations also have the Ayush units. So all together, these cater the public health demand of the country, and currently whatever the standards that we are actually developing, it should be uniformly applicable to all these facilities. So what is the limitations of the existing standard treatment guidelines? Actually, I would not say that it is a limitation, it is an improvement over the existing standard treatment guidelines. Whatever the streamlining in terms of what I told the initial slide, you remember that the prevention, what you call the promotion, then the what you call the diagnostic aspect, the treatment aspect, then the mitigation and rehabilitation. So in that context, actually the comprehensiveness is one of the important hallmark of the STG that we are actually now prepared actually. So with that inability to generate the scientific evidence, because in the each of the topic, at the end of each of the topic, actually we have given a list of references, list of publications where you can further refer. If you have that kind of aptitude, you can go through that publications and you can even contribute further for the research aspects of that. Many of you are already postgraduates. So in the public health facilities, the advantage is that you will get many disease conditions. If you have enough time and curiosity, you can understand that there are certain peculiarities and there are certain avenues for our system of medicine which you can appropriately document and make even a publication also. So that kind of effort has been given in these STGs. And another one is ICD-11 classification. So you may be aware that for the conventional medicines, ICD classifications are long. It was undertaken actually. So what is ICD classification? Somebody can tell what is ICD-11? Yeah, whatever in that case, what is that actually? It is a international nomenclature for specific identity of the diseases actually. So this is mainly applicable at that time for the conventional medical system actually. Later it was thought that for traditional medical system, traditional Chinese medicine, it was previously it was developed. Thereafter Ministry of Ayush along with the WHO has undertaken this task, and now it is developed as a separate chapter in chapter 2 in ICD-11 for Ayurveda, Siddha and Unani system of medicine. So you can refer, it is available, that ICD-11 classification. So that it is expected that we have captured that ICD-11 chapter 2 Siddha nomenclature in this classification wherever possible actually. These 6 disease condition, I think in all 6 we have taken care, this ICD-11 Siddha. Yes. So, so it is expected that when you are making a full-fledged HMIS for Siddha system of medicine, the disease condition you can easily make that encodement, that coding you can use as given in the ICD-11 chapter 2 classification. Then National Ayush Mission, I already mentioned that there is a public health program on musculoskeletal disorders, which will be detailedly explained by Dr. Virendra in the next session actually. What is the existing guidelines and what are the strategies, what are the modalities, how to implement it, how to report back, and all these things will be mentioned in next session. Then what we have undertaken, how we have undertaken this STG preparation, one national what you call expert committee was formulated, in which your nodal institutes from the Tamil Nadu, National Institute of Siddha and CCRS was consulted, and the secretariat for the working group was made in the NIS itself actually. So they have consulted among the experts available for even from private sectors also. They have included the technical experts, and thereafter an editorial on the behest of DGHS actually, a national level editorial board was formulated. In that editorial board actually 2 expert members from the modern side, Lady Harding Medical College and RML Hospital were also included, and finally the vetted guidelines has been published. These are the main what you call salient features of this STG. These are the contents, main contents of the STG, starting from the name of the disease and with ICD classification, case definition, then the case definition, then an introduction. In the introduction part, we try to make it very simple and very brief. In this very clearly we have mentioned what is the relevance of this disease condition to be included in this guideline. Why we included only 6 disease conditions. This is based on the incidence rate in our country, based on the strength of particular our traditional medical system. These are the 2 major criteria why we have included these 6 disease conditions. Then the diagnostic criteria, wherever the diagnostic criteria as per the Siddha system of medicines, whatever the clinical diagnostic criteria as adopted in the classical Siddha literature, it is part of that. In addition to that, actually, whatever the objective diagnostic criteria adopted in the modern system of medicine, that is also mentioned. Supporting investigations, differential diagnosis, because this is very important. Many a time there is a very what you call close shade of same clinical picture may be there for different disease conditions. So that distinguishing feature is very essential for appropriate management. So for that purpose, actually, very tabular format, the differential diagnosis has been mentioned, the principles of management as underlined in the classical Siddha literature. The another thing that we have added, which was not there in the other standard treatment guidelines, is the red flag signs, which has been after thorough discussion with the modern experts, actually this has been made actually. So sometimes you may be feeling that some of these red flag signs could that means even there also we can have our own management, but generally considering the entire country perspective, actually these red flag signs has been clearly made. Then preventive management, as I told earlier, the dietary practices, exercise, yoga, sleep, this is the salient features of the STG for the traditional medical system. This is what we are supposed to project in the community. So you can use, yesterday when we discussed with the director CHEB, she also suggested that we have to prepare some kind of IEC from this STG, so that we can popularly make a, for example, the widely publish in a popular way in every what you call health camps like that, so that at least the people will aware about that. Many of the things may not be, even though it is traditionally practiced, due to the modern civilization, many of such practices are obliterated from our community. So there we have our responsibility is to have project in the public domain, so that at least the people will come to our traditional medical system. Similarly, the interventions and along with the references. These are the 6 disease conditions that we suggested: osteoarthritis, rheumatoid arthritis, cervical spondylosis, lumbar spondylosis, then fibromyalgia and adhesive capsulitis. So fibromyalgia we have added because actually there are the conventional interventions is not yielding actually to considerable improvement in many of the cases, actually, that it is considered that traditional medicine have certain strengths to deal such cases, actually accordingly it was included. So currently we have given you a physical one physical copy we have given, but it is expected that we will now circulate in the e-book format to all of you, and even our website also we will upload that e-book format. So when you undertake this training further in the field, you can use that e-book format, that would be more appropriate. So now what is your role? Ultimately that is what I want to say actually. After getting this kind of briefing from national level, it is not a full-fledged training, it is only an orientation actually. After this orientation, actually within next 3 months in your state, whether it is in Tamil Nadu, whether it is in Kerala, whether it is in Puducherry, you have to undertake this further training, And how you will undertake the training? First of all, you have to make a proposal to your director or administrative in charge of your department, and seek their support in for conducting this training program in terms of, because you require at least 2 to 4 human resource master trainers from your state. Actually you have come 5 to 10 people have already came actually. So you can segregate region wise actually. In 5-6 region you can conduct this training program. So approximately 60 to 100 persons if a very large hall, because this is not a hands-on training. So even up to 60 to 100 persons can undertake that training program in a single day actually. So in that way you can divide, and region wise you can divide, and you can complete the task in 1 day or 2 days actually. It need not be fixed into 1 day alone actually. If you have enough resource persons are available, you can expand the training programs into 2 days training program. There won't be much problem actually. For that purpose, what we will do from the Government of India level actually, we will share with whatever PPTs available with us actually today, whatever the orations happening, that we will be share with you. Even the video recordings also we will be sharing in some form, we will be sharing with you, so that you can use it actually. But I require a commitment from you all that within next 3 months you will complete that training programs to all the field level officers. So the task is huge, because even Tamil Nadu, how many Siddha doctors are there in public health facilities? 1200. So if the 1200, then you can think about at least 12 such training programs may be required at maximum. So 12 training programs you can plan in the next 3 months in 3 different dates actually. So for that purpose, under National Ayush Mission, certain financial support has been given, not specifically this training program actually. Previously also we have given for undertaking various kinds of capacity building measures actually. Support has been rendered, and even for this state annual action plan also, your state government can take that financial assistance from the Ministry of Ayush for that purpose. So I think there won't be much problem. If any technical difficulties are there, then you can write to either National Ayush Mission or to the Ayush vertical in the DGHS, so that we will be able to render some technical support for that purpose. Okay. So I think this is what I was supposed to speak to you. This the same thing actually what I told, what are the importance of this essential drug list, and you have to ensure that whatever the drugs are required as mentioned in this guidelines, more or less it is available in your facilities. These are the beneficiaries, Ayush practitioners throughout the country, practitioners in centers of emerging integrated healthcare, Ayush professionals co-located, then the researchers, obviously the research councils, the persons with the research councils. So thank you. If we want to have some kind of discussions, then we can have any doubts or something like that on how to go forward with this training program. That's all. The technical aspect will be covered in the next 3 sessions actually. In fact, 4 sessions. That is a National Ayush Mission ka ek session hoga, 2 sessions on Siddha specific, 1 from the modern perspective. This is what we planned actually. Any things to discuss or something?
So, excuse me, sir. So the funds will be provided from NAM or?
Actually, this is what I am saying actually. For Abhi, so there is no separate exclusive funds for this training program, but already state governments has been supported for various activities in the flexible activities and the training. Training also, many of the state government has availed the financial assistance. So you can just dovetail on that training component for conducting this kind of training program, because this is one of the priority program for the Government of India. So I think states will make on board actually. So there won't be much problem.
So funds are already sent to state, or we have to apply for funding?
You have to state government, you have to approach the state government only. If they require the fund, they will approach to Ministry of Ayush. That is the way here. You need not write for funding to the central government personally. That is not required.
Yeah, already we have around 8 to 9 which will be managed by modern medical people.
Okay.
So we can utilize those centers for training.
Definitely, that is okay. And the NIS will always help you actually. Wherever the training, you can just, I think they can depute one person for the, as a resource person. Wherever it is available, they will do it because it is there in the Tamil Nadu state itself actually. And even in Kerala also they can have. That is what I think. Any other point, discussion? Okay, thank you all.